Hey, Dr. Karen Can here, and I am here with another LifeWave tip. Now, today's topic is a serious topic. It is about um, the complications and the effects of having a stroke, and how patching with X39, which is the stem cell enhancing patch, may be helpful to activate the acupuncture points in and around the brain area that is affected by the stroke. So there is a LifeWave leader. His name is Phil, and he's a professional speaker. And when he had his stroke, he had difficulty speaking, which means the left side of the brain, the vocalization area here, was damaged from the stroke. And that was very difficult for him. I didn't even know that he had a stroke. This was a number of years ago. But he had this deficit. And when he used the X39 patches, now I'm not sure where he used them. I'm going to teach you my preference of how you can activate acupuncture points. But Phil today now speaks normally and can go back to his speaking, his passion for speaking, and it's a beautiful story. So do not underestimate the power of light to activate your body's own healing mechanisms. So for those of you that this is brand new, what I'm talking about are these patches. It's called the LifeWave X39 stem cell enhancing patches. What they do is they activate a peptide that you already make in your body. It's called GHK and GHK copper peptide. This peptide tends to get lower and lower and lower as we age. And unfortunately, this peptide is super, super important to activate our stem cells. Our stem cells are those cells that can turn into any other cell. So for example, if you have damaged cartilage, a stem cell can turn into a cartilage cell. If you have damaged eye, the stem cell can turn into an eye cell, for example. So stem cells are really important, but as we age, we get lower and lower numbers of stem cells, and our GHK copper peptide is also low. However, if you can elevate GHK copper peptide, which has now been proven in a double-blind study to do that with these patches, then this natural ingredient that your body already makes, the GHK and GHK copper peptide, can go to work to activate your stem cells, get them younger, get them healthier, get them more active, right? So then they can go about and help you optimize your healing. So I'm going to show you some resources today, so you know how I would patch for symptoms of a stroke. So what are symptoms of a stroke? So if someone has a speech deficit, so they're garbled speech, they can't get it out, that's usually left side of the brain, you'd actually patch the left side of the brain. If they have right-handed or right leg issues, you would actually patch the left side of the brain. If they have right hand or leg issues, you would patch the right side of the brain. Okay. Now you're like, well, how do I know where to patch? Well, the patch actually works within about 4 to 6 inch radius. So anywhere on that side would be helpful because there's a ton of acupuncture points on the brain. However, I'm going to teach you how to be more specific based on the symptom or where you have the symptom. Okay, so I'm going to share my screen. All right, so I am going to share my screen. And right now, you should be seeing my screen where at the top, I've got brain homunculus. Yeah, say that 3 times fast. Homunculus, homunculus, homunculus. Oh, I could do it. Anyway, so what the heck is a brain homunculus? Well, it's a map of the brain based on how many nerve cells are responsible for that area that you wish to activate or that part of your body. So if you go to brain homunculus, okay, on DuckDuckGo, for example, and you scroll over to images, you'll see lots of different images of this homunculus. So I'm going to show you one that's a little bigger. See if I can find it here. There we go. Okay. So if you take a look at the bottom part here, where you see the whole brain, this is like a view from the top, okay? And this way is the front, and this way is the back of the brain. So front and back. Excuse the telephone ringing. Anyway, Gotta love it when they just time it perfectly. So what are the red and what are the blue areas? Well, those are the very important motor and sensory areas of the body. So remember, the left side controls the right, okay, and the right brain controls the left side. So in this picture, you'll see that in the red, they have what's called the sensory homunculus. So it's less of an issue usually with stroke. People aren't as concerned about losing their sensation in the part of the body. They're more interested in the motor function that is not working, right? However, you can patch both at once because the patch will be able to cover both the sensory and the motor area of this part of the brain, okay? So if you take a look at the blue, let's look at the left-hand side here. You will see that there are parts of the body on the homunculus that seem really, really big compared to other parts, right? Well, that just shows you how sensitive that area is and for the sensory homunculus, and also how many nerve endings, if you will, are there as well. So if you follow the homunculus from the inside, right, all the way out, you'll see the genitalia are way deep in there. Okay, in this gyrus or the space, and then it goes to toes, foot, leg, hip, trunk, and then it goes neck, shoulder, arm, elbow, and it goes down, down, down. Forearm, wrist, hand. Right? You see how big the hand is? There's a lot of nerves in the hand, right? We have a lot of intricate things that we do with our fingers, so that's why it's so big. So it's represented as very, very big on the homunculus because that's how important it is. And then you go nose, face, teeth, tongue, etc., right? All the way down the side here. And so what you can do is you can take your X39 stem cell patch, okay, your little white patch, and you can get a curl of tape, or you can use bobby pins if you're a bobby pin kind of person, or one of those newfangled rubberized hair clips that one of our leaders, Anna Kadena, told me about the other day. And you can actually tape it and right over that side of the head. Okay? So what you're doing is you're activating these acupuncture points in this area at the same time of giving that stem cell enhancing signal. So in this case, I would patch the area of the brain that's damaged. Now, it's really great if you have a CAT scan or MRI because it'll tell you exactly where it is. But you'd be like, how do I know where it is on my brain? I could sort of see it from there. Well, I'm going to show you another picture. Now, what you can do, of course, you can search all sorts of pictures on DuckDuckGo on there, but there is a hat that you can actually make yourself by printing out on a color printer, or this is for school. They teach these for children, but the hat's big enough for an adult. You can actually, it's called the Brain Hemisphere Hat. Okay, so here, this is just one site. You can search on DuckDuckGo for Brain Hemisphere Hat, make your own brain hat, that kind of thing. This one is here for you to paint, so you can actually print it out, staple it and glue it together, put it on your head, okay, and patch right over top of the cap. You don't even need it on the underside of the cap. You can go right on top of the cap. Now, you might look a little strange going to the store like that, although, sometimes I like being strange, so nobody's that surprised when I go to the store. Anyway, or you can do it at home. You can choose to do it at home, of course. So how often do you use these? Well, I would use them once a day. Now, I don't really, it doesn't really matter to me whether the person suffered a stroke yesterday or like 10 years ago. I would still use the same formula. I would still patch it. Like, for example, if it's the legs area, okay, that's kind of like in the middle almost. So you just patch it like in and around that area, right in the center. Yep. And then you can make, so we can do, I talked in another video about making intentions, because that is photonic energy as well. So you can use the crystalline energy of the patch, the stem cell enhancing, plus the intention of the actual acupuncture points that you're stimulating, and then your own personal intention, which is, hey, heal the brain, right? So you got these three, sets of frequencies, if you will, or frequency sets that you are activating here. And then you use it for 12 hours. Make sure you drink lots of water during the day so you're well hydrated, because the patches don't work as well if you're not hydrated. And then what you want to do after 12 hours is you want to take it off and take a break for 12 hours without the patch. And there's like a headband is a perfect way to put them on, because especially if you're a girl, well, guys kind of use the bandana thing too these days, right? So you can actually put the headband right on, and you can stick it right on the headband with some masking tape. Or if you're good and you're feeling, oh, I'm really confident that this is going to be comfortable for me, then go ahead and take away the adhesive backings. I'm using tape for demonstration purposes, but in your case, you would take the adhesive backings off and stick it to your head, or stick it to the headband, or stick it to the hat, right? The brain hat, for the whole 12 hours. And then we want the body to rest for that other 12 hours. As far as how fast would you get results? Well, I don't really know. It really depends. Years ago, when I patched a friend of mine who's an athlete, and he was elderly, but he's a very, very, very amazing athlete. And I actually patched him in the hospital. We did not have the stem cell enhancing patches at that time. But what I did do is figure out, where the stroke was. And I patched his head with what we had at that point was energy enhancer patches. And I have to say that he did very well. Now, it took 2 or 3 days, but he went from literally like absolutely no wrinkles on one side of the face to literally within a few minutes having wrinkles. Yeah, a few minutes. Now, that was an acute stroke, so meaning that those symptoms got better very quickly because it was very fresh, right? For an older stroke, those symptoms may or may not get better right away, but I would say still persist. I would say definitely use it for at least 3 weeks, to give it a really good go. So swallowing could improve. The person's ability to smile and chew, could improve. Their ability to talk could improve. The ability to close their eyes fully could improve, because those are all signs of, that the symptom reversing, working at walking better, feeling better, more stable. Those are the kinds of symptoms that we're looking for to improve as you're activating these acupuncture points and using the stem cell enhancing patches. So other than drinking lots of water and putting the patch in the right spot, I think this is a really great technology that anyone can use, especially if it's fresh. Like the faster you get that energy flowing, I find personally, the faster the person gets better. So for example, we'll do another video on what do you do when somebody has like pain from shingles. Okay, I'll do another video. But I got to tell you, if you catch them early, right, you treat them early, they don't have to go through these years of incredible burning pain from the shingles. You can still treat that, but like, why not treat it earlier, right? So if you know someone that may have suffered stroke and still has symptoms, whether it be recent or in the past, I would highly recommend that they try the X39 patches over the area that's damaged. And the nice thing about this is you become a preferred customer with a 90-day money-back guarantee. So you can try it for 3 months, which I highly recommend, and really, get, because it helps your body heal itself all over, not just the head, like your whole body, right? So what else we got? We got immune system, we got digestive system, the rest of the nervous system, we've got skin, we've got lymphatics. We have so many different systems that can benefit from stem cell enhancing. And there's no injections, there's no pills, there's no $25,000 cost, right? So it's like a no-brainer. So these are wholesale $99.95, which you can get wholesale. So if you don't have a LifeWave distributor that you can definitely connect with me, and I can, I have a team member that we can refer you to, or you can become a customer of mine. There's a preferred customer program, which is wholesale. And then there's, of course, a distributor program. I'm a distributor, so of course I get wholesale prices. And then there's, of course, retail as well, which is a singular purchase. But there's a lot of benefits to becoming a preferred customer. We know that we have so much data, so much, science, so much, 15 years of testimonials, 100 patents. We know the stuff works. So that was my goal today, to really share with you the importance of some new technology, and we might as well, take advantage of it, right? So if this has been helpful, please let me know. So what I'd love for you to do is if you are live right now, if you could just, put in the comments, how this has been helpful for you, that would be awesome. So say, yes, this has been helpful. If you're on the replay, please put the word replay on there before you say yes. So that would be super awesome. And of course, please remember to share this with anyone who you feel would benefit. I'm recording this from my Facebook profile, Karen Can. And so if you want, and also I believe the my Dr. Karen Can Facebook page as well. So those are public areas where you can share, share away. It's not, so if you're in a private group right now and you're seeing this live, just go to either of those places to share this publicly with others. Okay, great. Yes, so thank you, Poppy asks. I have stuck patches on caps or bandanas for wearing out. Yeah, absolutely. That is perfect. Okay, so share away. Hope this has been helpful, and I look forward to the next time where I have another LifeWave tip for you. All right, take care. Bye.